Now in this talk we want to start thinking about the basic ideas of sepsis. Now the modern idea of sepsis goes back to about 1992 and it's been taken up by the Surviving Sepsis campaign, and guidelines have been modified, so it's a well-established concept now, but it goes back to 1992. And the sort of sepsis we're thinking about begins with infection. So we notice we have infection. Now infection will lead to acute inflammation. So there's going to be inflammation. The infecting microorganisms are not supposed to be there. They initiate a host inflammatory response. And you probably know that that can give rise to the local effects of heat, pain, redness, swelling, loss of function. The local effects of inflammation: heat, pain, redness, swelling, loss of function. But how are these effects mediated? What are the inflammatory mediators? Well, there's several inflammatory mediators. You might have heard of prostaglandins, for example. So there's inflammatory mediators produced by the damaged tissue. So components are released from damaged tissue. These interact with tissue-based enzymes, and inflammatory mediators are generated. So we get inflammatory mediators. And it's these inflammatory mediators which actually generate the local features of inflammation. And damaged cells will also release cytokines. So there's inflammatory mediators and there's cytokines. Now cytokines are small proteins, they're small peptide units, polypeptide units, and they communicate between cells. So cytokine movement, cell movement literally. So these are chemical agents produced by one cell, detected by another cell. In essence, they're a bit like the endocrine system. The cytokines are messenger molecules. Now, if there's a lot of cytokines and inflammatory mediators, these are going to go into the body fluids. And will be distributed systemically. Now, also if there's infection, so normally bacterial or viral infection, these are antigens, things the body recognises as being foreign, and these are detected by the white blood cells, the leukocytes, particularly all the leukocytes really. I was going to say particularly the macrophages, the monocytes, but leukocytes generally will recognise the antigens as being foreign. And when they do so, the leukocytes will also produce cytokines. So you can see we're going to get cytokines from the damaged tissues, along with inflammatory mediators, cytokines, and we're also going to get inflammatory mediators as a result of the infection. And the cytokines released from the leukocytes are also going to go into the body fluids. So we now have body fluids containing cytokines which are circulating systemically. And it's these cytokines in the body fluids that can lead to the systemic inflammatory response syndrome. The systemic inflammatory response syndrome, SIRS. Systemic because it affects all the body. Inflammatory because it's caused by inflammatory mediators and pro-inflammatory cytokines. These cytokines will be pro-inflammatory. Systemic inflammatory response syndrome. So we want to see why we get this systemic inflammatory response syndrome. So we've noted that there's going to be these cytokines. There's going to be cytokines from here, cytokines from here, cytokines from here. I have a pen that works. So there's going to be two lots of cytokines. And these are going to affect various tissues. For example, they're going to affect the bone marrow. So the cytokines will affect the bone marrow. They'll also affect the hepatocytes, the cells in the liver. They'll also affect the hypothalamus in the brain. And they'll also affect the upper parts of the brain itself. And we'll see also that these cytokine effects will increase the energy demand of the body. So some of the clinical features of the systemic inflammatory response syndrome are going to be caused by the effect of the cytokines on the bone marrow, hypothalamus, hepatocytes and brain. And others are going to be generated by this increased energy demand that the body has. So what we want to do in the next slides is look at the bone marrow, the hypothalamus, the hepatocytes and the brain. See why this leads to an increased energy demand and derive the clinical features of sepsis and this acute phase response. So sepsis is really an acute phase response. Now, the acute phase response doesn't have to be caused purely by infection. Infection's probably best at it, but it can also be caused by tissue injury, surgery or trauma. In some neoplastic conditions, it can be an immunological reaction. But in this talk, we're looking at it as caused by infection, particularly bacterial infection.